Good afternoon. My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs for Hamilton Health Sciences. Welcome everyone to today's town hall on May the 27th. Where we have a packed agenda as usual today, and we'll have the chance at the end of the presentations that are about to come to have questions. If you have a question throughout the course of the presentations, you can always enter it in the Q&A function. Please use the Q&A function for questions, and we'll reserve the chat function for celebrations at the very end of today's town hall, which is always a nice way to close things. As we go, you may see that people have, our panelists have answered your question in the Q&A function, and you can review those answers just by opening the Q&A function and looking at the answered tab, and you'll see a list of all the questions that have been answered. And of course, if we don't get to your question today, then we'll do our very best to get an answer to you after the town hall. So to kick things off, I'd like to invite our President and CEO, Rob McIsaac, to give us an overview of what we're hearing about today. So Rob, over to you.
Thanks very much, everybody, and hi. Thanks for joining today's session. So late yesterday, we issued an update about our planning for return of services. These are services, at least to start with, that don't typically require an inpatient stay. We're also turning our minds to the return of staff who have been redeployed. The truth is, I think it's very hopeful that we're beginning to engage in these activities, but we're also a ways away from getting back to our routine activities. For sure, the good news is we're seeing cases start to decline locally, and I know I'm not the first person to tell you that, but it's important to keep in mind that the pressures on our critical care beds remain high for patients with COVID, as well as those recovering from the virus. Hamilton Health Sciences is also, of course, caring for those most severely affected by COVID-19 with our ECMO program. This equipment is used to treat those who have life-threatening or cardiac respiratory failure. Typically, we might have one or two patients on ECMO at any given time, typically being when there isn't a pandemic. During the pandemic, we've had up to 10 patients receiving this level of care at the General. And we are being asked to prepare to do even more than that in coming days. And this is an extraordinary call on our resources because of the intensity of this care. While we're doing all of that, we're of course doing all that we can to maintain access to our regional programs for patients who may come to us from across our catchment. And adding to all of that is the situation in Manitoba. Ontario hospitals have already received almost 20 patients as hospitals in Manitoba struggle to resource more ICU beds. And so we're watching that very carefully and know that we may well be called upon to help respond to that really dire situation in our neighbors just to the west. I think all of this is to say that as the pandemic continues to throw us curveballs, the resumption of services and return of redeployed staff needs to be done carefully and cautiously. Teams of staff and physicians are determining a path forward that will first and foremost take into account patient needs, but also do that with an eye on an equitable approach to care delivery, and of course the ongoing needs of the pandemic. We also need to factor in that everybody at HHS needs an opportunity to take some time for themselves after this very draining period in all of our lives. Details about next steps and what can be expected over the summer will be shared regularly as we do this analysis and finalize our plans. Excuse me. The other regular item on our agenda today is vaccine distribution. Second doses for high-risk healthcare workers have been accelerated, and the rollout is ongoing. So I want to say thanks to everyone who made it possible to implement this provincial directive under such a compressed timeline. I think I've said before that the province issued this directive without really there being any implementation plan in place, and so it was a daunting effort to make all of this happen. So my thanks to everybody, including Bruce Squires, who's helped to get us to where we are today. Once you're vaccinated, we are requesting that you please take a minute to share your vaccination status to HHS Employee Health Services. This information will be kept confidential by them. Please watch for instructions on our staff social media channels and in dispatch, or go to the hub to access this link. Couple more items before I finish today. First, I'd like to highlight Star Month, which officially kicked off yesterday. Between now and the end of June, there will be a series of recognition events and activities for all staff and physicians. If you haven't already, please stop by one of the cafes operated by our HHS Volunteer Association to get your snack and beverage. This week, we are also distributing some 4,000 t-shirts to support the national campaign called This Is Our Shot, the result of the excellent work of a few of our HHS physicians. For more details about other Star Month activities, please go to the hub and watch for updates in the HHS dispatch. And finally, this week, we also received a new CT scanner at our West Lincoln Memorial Hospital site. The installation will take place in June, and once it's up and running, it will provide new capacity to provide diagnostic imaging closer to home for patients living in West Niagara. So I know this is a really important project for the staff at West Lincoln, and of course for the residents in West Niagara who will get to take advantage of that important piece of equipment. So again, thanks to everyone who's been involved in that project. So thanks as always, everybody, for being here today, and I'll pass it back to Aaron.
Thanks a lot, Rob. So next up on our agenda, we have an operations update from our Executive Vice President of Clinical Operations and Chief Operating Officer, not Operating Officer, Sharon Pearson. So Sharon, what's going on across our sites and services?
Great, thanks very much, Aaron, and good afternoon, everyone. For the operational update today, we'll touch on a lot of our typical items that I speak to. Rob referenced the out-of-region transfers, and each week I've talked about the volumes that we've been seeing. It has been a couple of weeks now since we received out-of-region transfers of either ward patients or ICU patients, the exception to that being the ACMO program patients that Rob did refer to. Our critical care pressures do remain high through this hopefully last leg of COVID. To put the relativity of the COVID numbers in context, right now there's 45 patients in the ICU with COVID or COVID-related critical illness. We opened 38 beds as part of the pandemic response for COVID. So you can see we are still exceeding that number of beds. We also remain considerably high as far as occupancy goes in the ICU when you consider we are ramped down with respect to our typical surgical and procedural care. The ward activity has subsided. We never peaked as to the numbers we thought we may. We have always been planning for the 15% capacity relative to our med surg beds, which was around 100 beds. We did get pretty close to that, but right now we're sitting around 23 patients. So we do see the ward level acuity sitting at that number. The outbreaks, we only are at 2 right now, which is terrific. Certainly 0 would be better, but we had reached a high of 7 throughout the pandemic. And I know that places inordinate pressure on the sites when we have those outbreaks. So 2, and I think hopefully on the horizon, we will see those outbreaks resolved. If we go to the next slide. In terms of the critical care capacity, it is the focus of conversation across the province. These are, of course, the sickest patients that we're seeing, particularly those that require ECMO. There's been, again, even further conversation this week about the provincial demands on this service, and everything's being done to try to increase capacity across the sites. It's a very focused program with only 4 sites offering this service regionally, and very limited expertise in the province to support that. So Leslie Gauthier and team and Deb Bedini looking to see how best we can maximize the resources we have and expand the program as best able to respond to demands. UHN, which is really the hub for the program, has exhausted their resources, working with sick kids already to add resources, and we certainly have been increasing in the West to provide support as we can between London and ourselves. The additional new pressure, as referenced in the opening remarks, comes from Manitoba right now. So we are seeing the influx of patients into the province. I know there's work underway to provide resources directly to the hospitals there. And I would imagine it'll be a balance between sending them resources and having to transfer out patients. Right now, HHS has not taken any patients. There have been patients come into the West, but we'll continue to obviously respond as we need to and work with our partners in the West to ensure patients are directed to the appropriate facility with the capacity. We were asked this week to continue to maintain capacity that we had. So this needs to reconcile with the modification to Directive 2 around the surgical ramp up that came last week. So if you go to the next slide, there was the direction that we could resume with caution, and that was emphasized, the non-urgent and emergent surgeries that did not require resources, specifically staffing resources and beds. Because right now the staffing resources from the OR, along with urgent care, ambulatory EPIC, are supporting staff. Our staff in the ICU. We are limited in our ability to respond to that modification and increase our outpatient surgical activity right now. I anticipate we will be able to, but it will be over the upcoming weeks, not in the immediate week or even the immediate 2 weeks. There's a lot of work being done looking at the ramp up. We need to have an equitable process across our populations and looking at site-specific resourcing needs as well. So we'll continue to keep you updated on the ramp up process. For the time being, the staff that are deployed need to be maintained in those temporary assignments that they're in right now. And again, thanks to those staff for being so accommodating, and to the staff that have welcomed them into their specific inpatient areas. Certainly the objective is to get people back into the routine as soon as possible. And the next slide. And then just lastly, we like to update every week on where we're at with the mobile health unit. We really are in the last leg now. In the next few days, if needed, we could open up the unit for patients. A few of us had the opportunity to tour last night. It is just remarkable to see the tent, the work that has gone into it, and the resources that it's equipped with. So kudos to the planning and operations team for just staggering amount of work on the project. Happy to take questions in the Q&A, and I'll pass it back to Aaron.
Thanks very much, Sharon. Next up, we have our epidemiology update from Dr. Dominic Mertz, our Medical Director of Infection Prevention and Control, to give us a view of what's happening in the pandemic this week. Dominic, where are things at?
Yeah, thanks, Aaron. And I really have a plan today to only provide good news. So not touching on anything that doesn't look as great. That's the picture from last week. Nunavut was struggling, Manitoba was struggling, all the other provinces were trending down. And on the next slide, you see the current week with Canada going down from 101 to now 72 cases per 100,000 per week. So a significant drop. You can see Manitoba still remains high at 227. Nunavut came down. All the other provinces, in particular Alberta, the case numbers are just plummeting at this point. Ontario is at 80 per 100,000 per week now. And on the left-hand side, you can see the epi curve for Canada. And we are close to where we've been between the second and the third wave. And I would predict within the next week, we should be at least as low as we've been between the two waves. Next slide, please. Our provincial epi curve you can see here with the clear peak here in week 15 and an ongoing decrease ever since. We are currently sitting where the black bar is. After the numbers today, I was a little bit hesitant over the last few days how to interpret the data, given that it was long weekend, relatively low testing volumes, whether that's reliable or not. Thursdays tended to be the days with the highest case numbers or among the highest case numbers over the last few weeks. And still we are sitting at 1,100 today. So probably even lower than that black bar at this point of time. So roughly 75, that's what we are heading to. So an ongoing decrease in case numbers here in Ontario for sure. Next slide. Hospital admissions. You can see again those big red bars, total hospital admissions with ICU that continues to decrease. Less than half now than what we have had during peak, but still significantly higher, as you can see, compared to where we've been between the second and third wave, not even thinking about how low we've been last summer. So this will take a while to get there for sure. Also, in terms of ICU admissions, you see that slower but ongoing decrease. Those are the red, the dark red bars. And then those small mini bars, almost black, showing you the number of intubated patients. Same here, slow decrease, not as quickly as for the ward patients, but most certainly an ongoing decrease there as well. Next slide. This is the Ontario modeling from 1 month ago, where we sort of settled between that yellowish and greenish scenario. We tend to get closer to the green scenario the longer we go into end of May, beginning of June. And then as you can see, what they predicted here was once we get out of the stay-at-home order that we will see some amount of a rebounds here. In the more updated modeling, which you can see on the next slide here, from May 20th, so next week, you would see that bump or stop in decrease, I would say leveling off with a partial reopening on June 2nd, while there's a green scenario, which would be partial reopening on June 16th, which wouldn't result in a bump. And it's probably this modeling mostly that informed the province to say we will likely or plan to wait until mid-June with reopening, and we will come back to that. I added again with the red line here where we are actually currently sitting, and we are actually performing better than even the best case scenario here. Next slide. This is the ICU data, which I still think from a healthcare system perspective at the minimum, but also when you're looking at the larger picture, probably the single most important metric, in addition to the daily vaccine uptake, of course, where we see an ongoing decrease, as I mentioned, but not as great as we were hoping for, I would say. The updated modeling on the next slide from last week shows you that, well, they sort of adjusted for the dynamic that we've had And we are pretty much following that trajectory now. And following that, we would expect to be at less than 500 in a week. So things are moving into the right direction, but again, not as quickly as the case numbers, which was to be expected. Next slide. So this is the Hamilton view, and that was sort of the moderately positive news last week, where we had that shoulder that you can see, or that peaklet, where after a significant decrease, things leveled off for almost a week. But what we've seen over the last few days, consistently below 100 cases, and now with the 7-day rate being actually less than 100 per 100,000 per week as per today, certainly on the right track again. It's hard to say what resulted in that shoulder there. When you're looking into age categories, it's interesting that it's the youth, so the less than 17 or less, that didn't show an increase, in fact didn't show a decrease, in fact showed an increase in case numbers during that time period, while the other age categories continued to decrease, but more slowly. And now all the categories seem to be declining again more quickly. But as I said, difficult to say what resulted in that observation, but certainly over the last few days, we see again the cases coming down very, very quickly in Hamilton as well. On the next slide, we switch back to the healthcare system. Today, that would look a little better. Here it looks like this week is exactly the same as last week in terms of confirmed COVID-19 patients. It continues to decrease, but slowly at this point. And what you can also see is how that proportion between total number of COVID patients to ICU patients starts to get bigger and bigger. So we have more than half of our patients, that Sharon showed you, are now in the ICU. So we see a relatively rapid decrease in number of ward patients, but the ICU piece, the piece that's really putting a strain onto our system, continues to decrease only very slowly, regardless of whether it's intubated or non-intubated patients. And we are now roughly where we've been a week prior to the peak in hospital admissions, and it took us 4 weeks to get there. Next slide. I wanted to touch on the roadmap to reopen today, and people probably saw this in the news. And as you can see, the key metric that the province plans to use is the proportion of adults who had at least one dose and later on are fully vaccinated, while they are looking at other health indicators, and we will get back to that and what the implications would be, plus that we would wait 21 days to move from one stage to the next. Next slide. So where do we sit in terms of vaccination progress? So this is from the COVAX system, where you see doses administered by age group. Blue columns being the population with at least one dose, and the turquoise, the people vaccinated with fully vaccinated. And you can see we are above 90%, which is terrific in the age group of 70 plus. Then we drop down into the 70s, looking at the 50-year-olds. And then, of course, dropping further from there. But even in the age group of 12 to 17, already 11% have been vaccinated, which was quite surprising to me. I didn't expect that this happened so quickly. Next slide. When you're looking at Ontario, and that's data from a couple of days ago, so certainly changed significantly since. We are probably at more than 8.5 million vaccinated at this point in Ontario. That translates to roughly 64%. So in the meantime, probably 65% of the adult population with at least one dose. In Hamilton, we are lacking a little bit behind because we weren't considered as one of the major hotspots. So the GTA has higher vaccination rates than we would have. We were sitting at close to 60% a couple of days ago. I've learned yesterday, however, that our public health folks have a little bit more advanced data with better data cleaning, and the COVAX data apparently is roughly 1% higher than it actually is. So we were in fact sitting at roughly 58.5% there, but very close to those 60% that the province wants to see for stage 1 reopening. Next slide. Fully vaccinated, less than 5%, regardless of whether it's Ontario on top or Hamilton at the bottom with 4.6%. Next slide. So what does that mean for our reopening plan? You've probably heard that the province is planning to go to step 1 around June 14. The 60% adults with 1 dose at the provincial level we have already achieved, but there are certainly pockets that haven't achieved that yet, or pockets, communities that may not have reached the 60% yet. And it remained unclear whether it's a provincial average or whether we are looking at every single community being at above 60%. But I think the main trigger at this point to delay the reopening, at least that's my interpretation, are those other key health indicators, which you see at the very bottom there highlighted, which is declining hospitalizations, ICU cases, rate, and percentage positivity. Now, all of those are declining, but probably not quickly enough, or in particular from an ICU perspective, still having a strained system. My best guess is that's why we keep waiting despite the fact that we've reached those 60%. Now on the next slide, I made some basic math about whether the vaccination status will be a limiting factor, and bottom line is it doesn't look like it will be. So compared to the status right now, pre-stage 1 reopening with already 60% achieved, we are already meeting that criterion for stage 1. For stage 2, we require 70% first doses, 20% fully vaccinated. So we need to increase the double vaccinated by 15%, the fully vaccinated, the partially vaccinated by 10%, the fully vaccinated by 15%. So a total of 25% of the population needs another shot, so to say. And at the current pace of roughly 0.9% of people getting vaccinated, of adults getting vaccinated each day, this will take us roughly 4 weeks. So we should be there actually by the end of June. So the rate limiting factor going into stage 2 will be the waiting for at least 3 weeks after we moved into stage 1. And there's even less of an expectation going from stage 2 to 3 in terms of vaccination rates. Yes, we require 25% fully vaccinated, optimally again another 10% partially vaccinated, but we are looking at an increase of 5 to 15% with the current vaccine supply. That shouldn't be an issue. And vaccine hesitancy, roughly 1/3 or probably less than 30% have some level of hesitancy or have said so, but it looks like we are probably looking at roughly 10% of people who will continue to refuse the vaccine. So those 80% should be visible, and it's well possible that we achieve that even before we will be moving into stage 3. Turning back to you, Aaron. Thank you very much.
All right, thanks, Dominic. Always good to hear some good news. Next up, we have Bruce Squires, our VP of Women's and Children's Health, who's going to give us an update on the vaccine effort that he's been contributing leadership to support. So Bruce, what's going on in that realm?
Thanks very much, Aaron. And let me first highlight that following Dr. Mertz and preceding Dr. Smale and talking about vaccines is certainly humbling, as they both are great experts and outstanding communicators. I'll just highlight that Dr. Mertz has really shown great data on how far we've come since, and you know, I'll say that that's actually also true in Hamilton, since the very first dose was delivered back on December 23rd at the 293 HHS site. We started really slowly, but we've now reached a level of momentum that saw about 5,700 doses per day in Hamilton over the last week, including a record 6,500 plus on both Friday and Saturday over the long weekend. And that mirrors what we have been seeing provincially, where it took, as you can see from this slide, it took 81 days to get to the first 1 million doses. Now it's taking a week, a little over a week, or even in some days right on a week to do the same. And we've really been maintaining that pace now for, as you can see, for 4 weeks. If we keep that up, it's a little over 2 weeks to get to 75% with 1 dose. And Dominic has helped us to understand that. The speed of that delivery, of course, is driven by supply. And it's really great to see that we anticipate similar levels of supply as we've had over the last month for June and for July. But it's also driven, of course, by uptake. And the positive uptake that we've been experiencing has led the province to move more quickly through its prioritization of groups for vaccination. So last week I told you about how they were expediting the move to 18 plus. Well, this week I can highlight that over the weekend, the province was fully almost 10 days ahead on opening up to our youth, our 12 plus population. I can also tell you, and I promised this last week, that the province did move to administer second doses of the AstraZeneca vaccine before those doses would expire, and in line with expectations of that monograph to those who received AstraZeneca. And that, in fact, included over this coming weekend, we'll be doing that at the Urgent Care Center. Let's go to the next slide, please. So our role at HHS in all of this really continues. We've been operating the inaugural Hamilton Vaccination Clinic. Of course, it's about us reaching out to our patients and our families and educating them, including those with health conditions. And of course, we have a regular ongoing process now for vaccinating our inpatients who are en route to long-term care, other facilities, congregate settings. If we go to the next slide, as I mentioned, the youth strategy actually rolled out on Sunday. And what that means is that that youth in the province, as of their 12th birthday, are able to book an appointment at any of the clinics that are offering the Pfizer vaccine, which at this point is the only vaccine product that's approved for this age group. In addition, we at Hamilton Health Sciences and McMaster Children's are working really closely with public health and with the school boards on providing a dedicated, focused clinic during the weeks of June 14th and 21st. Those would be really family-friendly, youth-friendly clinics. As well, we're also ensuring that there will be other channels available targeted at at-risk youth. Resources on this will be very shortly in detail available on our website and of course on public health. As I said, they're working on this right now. In fact, I'm missing a planning meeting at this point, and so we can expect further details very shortly with respect to this strategy. Next slide, please. Last week, and Rob mentioned this, I also talked to you about the approach that we at HHS and the city had to put together on pretty short order to move forward the second doses for high-risk healthcare workers that had been identified as a specific group by the province. Again, unfortunately, the provincial electronic booking system did not provide an efficient, effective, reliable, even possible mechanism to do this. So last week, we initiated the delivery of text messages to the available HHS healthcare workers. And we also told those who felt they were eligible but didn't receive a text or needed to change the appointment that had been rescheduled to use the phone system that was set up through the citywide infrastructure, but is being staffed by the folks from St. Joe's Healthcare Hamilton. Ultimately, there were some big challenges with that phone system. And I acknowledge and recognize that many team members experienced great frustration. I sincerely apologize to everyone who felt that frustration. So as a result, as of today, we have put together a new process. If you were redeployed or fit the criteria which are on the next page, which are the definitions of high-risk workers, and if you're eligible for an accelerated second dose, and if you haven't received notification, here's what you do. So we'll ask you to tell your current manager that you are interested and you fit the criteria, and to provide them with your contact information. They're going to submit that information, contact information, and then you will receive a call to rebook your second dose. The call will be between June 1st and 4th, and the second dose will be booked essentially immediately following that. I want to highlight that this relates to the high risk healthcare workers as identified by provincial direction, but we as others continue to advocate for an acceleration of second doses for all of our workers. And we do expect, as vaccine supply is much more significant and we're making good progress, that the province will provide some announcements and direction on that soon. Let me close by just again highlighting that I encourage everyone to share your vaccine status, and of course to get vaccinated, and encourage friends, family, neighbors, anyone who would listen to get theirs as well. Thanks very much. Back over to you, Eric.
Thanks very much, Bruce. As you said, next up on our agenda is Dr. Fiona Smale, who's a medical microbiologist and infectious disease expert who's joined us on past town halls to talk about the vaccine in more detail. So Fiona, over to you. Interested to hear what's evolving in terms of our knowledge about vaccines.
Well, thank you very much, Aaron. I thought I would just concentrate on 3 or 4 issues that reflect the type of questions that we're getting around the vaccines, and some of my own personal experience as I'm working in the vaccination clinics. Number 1 relates to the Moderna and the Pfizer-BioNTech vaccine. The important thing to be aware of that these are both mRNA vaccines. They both have the same technology. They both have the same overall effectiveness and the same overall side effects. Both of them after a second dose, estimated at 90 to 95, well, actually probably 95 to 96%, and one is not better than the other. I've had people come to the vaccination clinic and they're either happy that they're getting one or unhappy that they're not getting the other. And it takes a little bit of time to explain that these are virtually identical vaccines. We are still recommending that the second dose be with the same vaccine type as the first, and anticipating that we will have adequate supply of both vaccine types to actually do this. So the second question I often get relates to the AstraZeneca vaccine. And I think most of you are aware now that first doses with this have been pulled back. However, the second doses are being rolled out, and the risk of an adverse event after having a second dose seems as if it's in the range at this point of 1 in 600,000 to 1 in a million, so very low. And the recommendation is that those who've already received a first dose of AstraZeneca to receive a second dose of AstraZeneca. It's probably now going to be 10 weeks rather than the original 12 weeks, and that interval is just fine. There's no concern about that. And in fact, it gives you a little bit of a head start in terms of the immunity. As Bruce mentioned, we have a pop-up clinic, and I'll be there giving AstraZeneca on Saturday at the West End Clinic, the Urgent Care Centre. At this point, it's probable that there will be clinical trials, and some of you may have seen this reported from the UK, that we may be able to boost with any of the mRNA vaccines, the Pfizer or the Moderna vaccine, as a second dose after somebody has received the AstraZeneca vaccine. I think this is probably going to be more theoretical for us here. I'm anticipating it will be protective, although there may be, from preliminary data, some more milder side effects still. But until we see these data, this approach is not recommended. And so if anybody is having a discussion with friends, family, neighbors about what to do if they've received the first dose of AstraZeneca, I would, and feel very confident, suggesting that they proceed and get their second dose as soon as they can. One question that is coming up as we're seeing more of the variants of the coronavirus is the question is, how good are our vaccines going to be against these new variants? You'll have heard of the new strains that are circulating both in the UK, Brazil, South Africa, and more recently in India. And our concern is that these variants may be easier to transmit between individuals. The data that we have at the moment, and I must admit it is preliminary, is that 2 doses of any of the available vaccines are in the range of 85% plus effective against disease. But this is still evolving. And it is, of course, one of the reasons why we're advocating strongly and have for our healthcare workers to get that second dose, and similarly advocating for those most at risk in the community to get their second doses as well. And this is, as Dominic mentioned, one of the metrics that will be utilized as we look to reopen our communities. So those are sort of the highlights of what I think are relevant at the moment related to vaccine. And of course, we can take questions. Back to you, Aaron.
Yeah, perfect. Thank you very much, Fiona, for that. We do have time now for a Q&A session, and I'd just like to remind everyone that our panelists have been busy during the course of the presentations responding to questions in the Q&A function. And you can review the answers to the questions you posed by just clicking on the Answered tab and taking a look there. But we also do have some new questions coming in. And just a reminder to everybody, please try and use the Q&A function for questions. We'll reserve the chat function for celebrations in a moment. You can also raise your hand as a participant in the session today, and we'll call on you to ask your question live. So we're seeing here, we have some questions about the AstraZeneca pop-up clinic this weekend. Is it for certain people or anyone who got their first dose? And how does one book into the clinic in particular? I don't know. Perhaps Bruce, maybe you want to jump on that one around the AZ pop-up clinics.
Yeah, thanks very much, Aaron. So the AstraZeneca pop-up clinic is limited to folks who received their first dose of the AstraZeneca vaccine in early mid-March. And so the reach out to schedule those folks is happening through the primary care sites that provided those doses. There's more information available on the Hamilton, City of Hamilton, sorry, web page. But the real key point there is it really is time-based. So the province is not yet rolled out for AstraZeneca second doses for those who received them in April, for example. And it's really important to know, and Dr. Smale may want to comment on this, that in fact the monograph would not recommend having that second dose of the AstraZeneca vaccine, I think in advance of 10 weeks after the first, if I remember correctly.
Yes, that's correct. The discussion has been 10 versus 12 weeks, and the 10 weeks is going to be entirely appropriate.
Good stuff. We have a question here too from our colleague, John Morales, who's leaving HHS at the end of the month, but is asking the question, and I'm sure this really covers for other people too, that might have gotten their first dose, but then maybe moved on to another opportunity elsewhere. Is there anything they should be doing now to make sure that their second dose is lined up?
Thanks very much for the question, Aaron, and to John. And the province has recently made adjustments to the provincial booking tool that allows you to go in and to confirm the location of your second dose and the timing. And they are suggesting that there will be mechanisms to allow for that second dose to be rebooked. That second piece isn't ready yet, but you are able to go in and confirm the status of and the timing of your second dose. Maybe we'll make sure to put the kind of the navigation details of that in an accessible place on the hub.
Great stuff. I do see a couple of questions, just comments really about addressing the topic of vaccine in children. So great points. We'll look to have that as a content area for our next town hall, but maybe Dr. Smale, if you wanted to take a look at those, maybe you have some insight for somebody now, and we'll bring that to the larger group next week. There's this question here about antibody testing from Michelle about what should we be telling our patients who are asking about antibody testing? I'm not sure, maybe Dr. Mertz, if you have any advice, or Fiona, Dr. Smale.
Well, I can confirm there really is no role for antibody testing. People may be asking, should they have this after vaccination to confirm that they have the vaccine is working. Antibody testing has never proven very helpful for diagnosing COVID infection, and the duration of antibodies after an infection is very variable. So even knowing that somebody would have had COVID is uncertain. There is an inflammatory condition that occurs in children and potentially even in some adults where antibody testing may have a role, but this is very limited. We do have testing available through the HRLMP lab, but it does need approval. And I really wouldn't recommend that anybody go out and find a private source. It's not really going to help you at all.
Understood. Okay, thank you. Well, I see there are some questions remaining in our question box, and I know that there's some receiving answers right now. I'll encourage our panelists to take a look at those before you log off and see if you can provide an answer. If there's any that we don't get to, then for sure we'll make sure that we try and get back to you directly or post an answer on the hub. Or carry that forward to our next town hall so that the topic can be addressed then. As always, between now and the next town hall next Thursday, if you have questions you'd like to pose or topics you'd like to see covered, you can always email hhsnews@hhsc.ca, and we'll be sure to take that into consideration. I want to move now to our celebrations so that we can have some time to celebrate all the wonderful things that are happening, the accomplishments, the hard work that's going on across the organization. So you can type a celebration that you'd like to give, a shout out or a thank you, a congratulations in the chat function. So using the chat function, and we'll read that out for you. If Rob's available, he'll join me as well. And then we can also, you can raise your hand as a participant or a panelist, and you can give your shout out live. So those are the two ways we can do this. Maybe I could start just by giving a shout out to Lucas Milanovic, who stepped in as host for me last week. I know he was the first person we thought of after the other three people we wanted said no, and he was just so glad to jump in. And I know it's such a hard job to do what I do, but Lucas, I heard it went okay. So thanks a lot.
Yeah, Lucas did very well, Aaron, although I don't say that to make you feel nervous in any way, but if you're not feeling well, don't worry about it. We do have a very competent replacement for you.
Sounds good. Okay, so reminder, you can type into the chat function. Not seeing a bunch show in, and as well our panelists and attendees, you can raise your hand and give your shout out live. Sharon, I see you've come on camera. Is there something you'd like to celebrate?
I would. I just wanted to make note of all the work that's being done in the post-acute settings to support hospitals. Every so often we bring this up, but concurrent to all the activity in the acute side of the house during the pandemic, all of our home and community care partners have been doing a lot of work to expand capacity and expedite their processes. The long-term care, certainly they've had their challenges through COVID. Of late, there's been a lot of work done to expand capacity, to change their historical processes, to admit patients in different ways, at different rates. We've seen that reflected in our ALC numbers, all-time lows of in the 115 range, never seen anything like that before. So home and community care, our long-term care partners, our other community partners, primary care have all stepped out. So just a big shout out to that sector.
Thanks for that.
Aaron, maybe I'll give a shout out to the ICU wards at the Hamilton General in particular for the outstanding work they've been doing with ECMO. It's been a tremendous expansion, and so much so that I think Critical Care Ontario is looking at us to do even more of that work. But it's very intensive, and I think at the moment we wish we had more staff to be doing that work, but the staff who are there are really stepping into the breach and fulfilling that role for these very sick patients. So great work at the Hamilton General Hospital.
Nice. Thanks for that. I see one here from Leslie Gillies. Thank you to all the deployed staff and receiving staff who are continuing to provide excellent care and support each other during these challenging times. Thank you to the CSO team for continued support with scheduling. Great stuff there. Leslie Cosi, I see you have your hand raised. Would you like to join us on camera for a celebration?
I am, thank you. So I just wanted to take this chance to acknowledge the retirement and the longstanding career of Patty Walton. Patty Walton retires from HHS as of tomorrow and has actually worked as a frontline staff nurse at West Lincoln, the old Juravinski Henderson 592, and most recently has been a manager of the Hamilton General OR, supporting the cardiac and vascular team and the Juravinski PACU and same day. And Patty's been with us for many years and has really made a difference for an awful lot of patients and teams. So thank you, Patty. And officially, we wish you all the best.
Nice, thanks for that one. Thanks to Patty.
Aaron, I see Marita Tonkin has put a special thank you to all of our physiotherapists and PT and OT assistants across HHS as we celebrate Physiotherapy Month this May.
Great, cool. Thanks for that, Marita. Bruce, I see you on camera. Is that celebration related?
It is, Aaron, just to celebrate the staff of our cafes and cafeterias who of course over these 2 days are distributing that thank you to all of our teams, but represent us to ourselves, but also to our patients and families and visitors every single day. So I hope everybody gets a chance to say thanks to those folks for all they do.
Yeah, great recognition. Thanks very much, Bruce. Kelly Campbell, I see you've come on. I'm assuming that is also celebration related.
Yeah, thanks, Darren. I was just going to add to Bruce's comments to thank officially the HHS Volunteer Association for their support of not just this week of treats, but of all the staff appreciation events that they helped to sponsor over the course of the year. We certainly couldn't do it without their generous offer and donation of treats and their time and their financial contributions. So just a big shout out to thank Tina Cooper and her team for that support.
Wonderful, thanks. Well, Rob, I think we're slowing down in the chat function, and we're getting close to the half past the hour. So why don't I turn it over to you for final remarks?
Yeah, thanks, Aaron. Maybe there's just one final one in there. A thank you to our cancer program, staff and physicians who have worked tirelessly to support patient care during the period of redeployment, and to the many who are supporting the ongoing vaccination of patients with cancer. So thanks, Georgia, for putting that in, and thanks to all of those staff and physicians. And thanks, everybody, for joining today. As always, great job to our panelists who do such great work in keeping us informed, and to everybody who found time to attend today or watch this in recorded fashion. It's great that you checked in, and thanks for all that you're doing here at HHS. And we'll hope to see you again back at our next week town hall. Thanks, everyone.